Again, the White House describing the president's symptoms as mild, nothing more specific than that, although they have mentioned, sources have mentioned a cough, fever, and congestion. But his case is especially concerning because the president's in a high-risk group. Dr. Maria Simbra has a look at the factors that put the president at a higher risk of having a tough time with the disease.
The president has a number of factors that put him at risk for more severe illness. One of these is his age. He is 74.
That does put him at a higher risk for complications related to COVID. So it's going to be a higher risk of a more severe illness. It's going to be a higher risk of also death, unfortunately. And it's certainly increased in comparison to, say, his wife, who is in her 50s.
While Dr. Nace is not involved in the president's care, he points out another factor.
The one thing we do know that he shared is obviously the fact that he is overweight. And obesity increases the risk of bad outcomes.
The testing was likely expedited.
So it's most likely he had a rapid antigen test that was done, and that was then subsequently followed up and confirmed with a PCR test. Because it's the White House, it is the president, it's likely that that can be turned around relatively quickly.
Now he must quarantine and stay separate from others.
We know that he's positive, he's capable of passing it to somebody else.
And he'll be monitored.
Ongoing, frequently look at the symptoms, the temperature, watching the oxygenation.
Anyone who is within 6 feet for longer than 15 minutes without a mask will need to be tested. Democratic nominee Joe Biden has tested negative.
Probably they're going to be retesting him at some point, the 14-day window from the exposure, and they would be monitoring him on a regular basis.
The most worrisome factor to Dr. Nace is the president not using a mask.
It certainly increases his risk. It's what I worry about because he hasn't had that mask. He is likely come in contact with a much higher amount of virus than he could have had he been wearing a mask. It reduces the severity of illness if you do get infected. If you get this much virus, you probably won't get much of an illness. If you get this much virus, you're going to get much sicker.
The president could manage his illness at home at the White House if his symptoms are minimal, but if he requires significant oxygen or if there is a concern for other organ involvement, such as the heart or brain, he would need to be hospitalized. I'm Dr. Maria Simbra, KDKA News.